Hey everyone, it's DrRic, and today's unboxing is on N-acetylcysteine, NAC. This is by Now Foods. Good story. I was heading over to see my friend Rich over at Advocate Sherman in Elgin, and I happened to stop by Fruitful Yield to pick up what I thought would be my magnesium, and I stumbled across NAC, and I said, hey, that would be a good topic to talk about. I've always wanted to do a video on NAC. I might have done one a long time ago. And then Joe, the manager over at South Elgin Fruitful Yield, introduced me to a new client over there. And she's a sweet lady, 86, I think. And she said, I am so tired of taking Eliquis and losartan. Eliquis is a blood thinner, and losartan is a blood pressure medicine. And apparently she told me her story while I was in the aisle with Joe. And she said she had atrial fibrillation. That's when the heart goes into a weird rhythm really fast. And typically cardiologists will have to destroy part of the lining of the atrium to stop that fast rhythm. It's called an ablation. But in most cases, once you destroy it and stop that fast heart rate, you shouldn't need a blood thinner. In her case, he said, do I need to take it? He said, I'm supposed to give you a blood thinner, but if it were me, I wouldn't. That's what he said to her. So I think he was trying to follow protocol, CYA, cover your ass. But, and that I have to talk about that in another video, but he also hinted to her, you can probably stop taking it. That's how I understood it. She stopped it and she said, this is the reason I stopped it. And she pulled up her pant leg. She had a huge gash in her shin and it was bleeding. I'm thinking, this Sunday, are you going to church? You're bleeding. We should probably stop the bleeding. But she was okay with it, and she didn't want to do anything. I can understand why she wanted to stop the Eliquis, the blood thinner, because she was bleeding. In all respect to her and a cardiologist, you have to make sure that that blood thinner, once you stop it, does not allow a clot to let loose and cause a stroke. But anyway, that's part of what I'm talking about today is why NAC would be helpful for her, or my friend Rich. Second story I'll tell you in a second, but this is the size of the capsule, and NAC, or at least Now Foods NAC, was approved by Consumer Labs. I'm a subscriber to Consumer Labs, and I've been following them for a long time. They're a third-party company that takes vitamins off the shelf and just tests them randomly. And they usually put their findings as far as whether what's in the batch that they test, as far as the capsules, is actually on the label. And a couple of the companies they have not approved, and some companies are really big. And it's nice to see the big companies scramble because they probably watch Consumer Lab evaluations. And I've seen a couple companies try to say, well, we did this, we did that, we're missing a couple things. They tried to explain to the followers of Consumer Lab in a letter that this is the reason why the batch was off. And then I think some of the letters were, we will fix it from here. So it's nice when a third-party company is acting like a watchdog, because we need that for us as consumers. But my second story was that when I went to go visit my friend Rich in the hospital, he's a pancreatic cancer survivor, and unfortunately he's got a huge blood clot in his left leg. I mean, his leg was like a tree trunk. For certain reasons, he cannot be on a blood thinner. You're supposed to be on a blood thinner when you have a blood clot, because the blood clot in the leg will set off a little piece, and that piece will go somewhere, and that could cause a stroke or a pulmonary embolism and kill you. In his case, because he could not be on a blood thinner, they had to put a cage, a wire mesh frame in veins here to stop the clots that were cutting loose from getting to the lung or the brain. And that's kind of barbaric, but that's the only thing that's available to him, because he cannot be on a blood thinner. So I thought, and I'll tell you why NAC is good for both of these two patients, is because there's very low side effects, and it's great, has a lower end blood thinner, and I'll show you the data. But first, let's get to the details. And if this is the first time you're finding me and you like this video, don't forget to hit the thumbs up button, because it does help the channel continue on and helps me, in addition to feeding the YouTube algorithms so we can produce these videos further. Subscribe and hit the alert button to find out when I do new videos. Well, the first study I'll show you from PubMed shows how it helps with community-acquired pneumonia. And that's given. In fact, I told you already that it does help in the case of cystic fibrosis. Well, in the last decade, it's been used for community-acquired pneumonia. It's also called atypical pneumonia. Those are like bronchitis infections, lung infections, pneumonia infections you get in school or at the job, and then you go to the doctor's office because of coughing and chest pain and phlegm, and he give you an antibiotic, usually Z-Pak or Biaxin, doxycycline, Levaquin, Cipro. And there was a positive effect of the NAC when they gave it to patients with community-acquired pneumonia. And this study was nice because they broke it down into not only just following the patients and looking and seeing who did good and who didn't do well, but they also did the data search, and they found that several different blood components, especially TNF-alpha, which is tumor necrosis factor alpha, were found to be lower in the NAC patients. So already we know, because they were nice enough to do some data, not only just subjective, how you feeling, which is helpful, but they also did data analyses, and they found tumor necrosis factor decreased. And those of you who follow COVID, you'll probably remember that word tumor necrosis factor because it is one of the cytokines, or it's part of the cytokine storm. Tumor necrosis factor is released, and it's supposed to be helpful in a way, but when it's out of control, it could be bad. So bottom line is that when you have an infection and tumor necrosis factor is high, it could give you some bad feelings. In many cases, it can also propel you to death. But when you decrease that one factor, it might pull you back and have you recover faster. So positive effect with N-acetylcysteine. And here's another study I pulled off from PubMed. Hopefully you saw the last one. I don't know if I showed it that close, but this was just to show that it's not just random, but the more data that comes about, the more scientists that find there's interest in this NAC, the more money gets funneled into studies. And this study was evaluating why it worked. And they were able to find that some people have a glutathione S-transferase deficiency. So if you're into integrative medicine, some of you might know MTHFR deficiency. MTHFR, it became popular about 10 years ago for people with chronic disease, fibromyalgia, chronic fatigue. And it was found that some people had deficiency of that one gene, and it might have led them to have those symptoms. So easily, if you had the deficiency, you took more methyl groups and bingo, you got better. At least that was the thinking. Now, that's a loose association, but the same thing happened, or at least the same thing was attributed to people with glutathione S-transferase deficiency. So the science has found that if you do have deficiency, and it sounds like it might just be random to a couple people in the population, but it's not just a couple people in the population. NAC helps many people. This is just one chemical step that will show that it helps. In chemistry, it shows that NAC, if you take it and you have a disease process and you happen to have glutathione S-transferase deficiency, it will help you. But you don't have to just have that. You can just have pneumonia, and I'll show you why. So interesting that the science is starting to show why these things, these vitamins help. That's why I love science now. I don't want to get too detailed into science because I think that might bog some people down, especially folks that are just trying to figure out, like my 80-plus-year-old lady, if she's trying to figure out, what can I take instead of Eliquis? NAC. And if I throw too many papers, it might not be that helpful. So this is a paper that talked about von Willebrand factor. And again, science is great. They evaluated why people might be turning the corner. And another thing, in addition to the glutathione S-transferase deficiency, was people that turned around, they found that the von Willebrand factor was responsible for making them go downhill. Well, NAC took care of that. So when you have von Willebrand factor deficiency, if you get NAC into your supplement protocol, you might fare better. So I think it's not just a deficiency. There's many different levels that this supplement can help everybody, not just genetic deficiency folks, but also folks that are sick, like pulmonary disease, say the fibrosis of chronic obstructive pulmonary disease or cystic fibrosis, even in the form of just mucus plugs. If you, it's been known to use to help with that condition, even just with bronchitis. So those of you who have had pneumonia, you know you cough up a lot of phlegm, a little clam, sticky phlegm that you'll spit on the concrete. Sorry, that's a guy thing, I guess. But that's what comes out of the chest, and that's because everything is congealed together. Well, guess what NAC does? It breaks that apart, kind of the same way as the over-the-counter mucolytics. So if you have a supplement that does the same thing, but in more power, and also breaks up clots, why not? And this was the mechanism of action. This is really cool. That's why breaking disulfide bonds seems to be how the beauty of this thing works. It's not the only thing, but it seems to be the sine qua non of how it works. And I'm going to show you why. Disulfide bonds. This is how disulfide bond binds together. So if you have, those of you who get hair perms, I guess, you'll notice that if there's two hair strands and hydrogen and sulfide bonds that make the hair strands stick together, those of you who get permanence or curly hair, you have to get the hydrogen to break the bonds, and you curl the hair and you put it back together so you have permanently curly hair until the hair grows out. Well, with congealed mucus that gets sticky and thick, if you use NAC, it breaks up the mucus like this, and then you don't have to get stuck with mucus in your chest. So that's the way it helps with upper respiratory tract infections. So that's the spoiler here. And I don't want to take us too deep into the science part of this. I've been told that I probably sometimes go on tangents that are too sciencey. So I just want to keep this superficial, especially for my 80-plus-year-old lady who's probably going to be watching this, or for Rich in the hospital. But bottom line is that I think that there's low side effects to this supplement. And if we can't do a blood thinner, I think this is a great substitute at 600 milligrams twice a day. So most of these studies did 1,200 milligrams daily. There's other studies that went higher, but I don't think you have to. This is the best. This study, Circulation's a very well-known journal, and here they just took apart everything. In fact, they talked about mostly how good it was as far as clot busting. But it's never going to be to the same degree as warfarin, Coumadin, or Eliquis. But for folks like my 80-plus-year-old lady or Rich in the hospital who can't be on blood thinners, again, I think it's a positive. So I don't want to go through the entire thing, but if you want, for those of you who do want science, check out the article from Circulation, the journal, and hopefully you can see all the details here. That's it, May of 2017. So you'll see how it can help with your blood clot, or at least to loosen up stuff. And this is how I think my COVID patients, and that's why I use it for some COVID patients in my COVID clinic. Well, I have an algorithm, but this doesn't really apply to everybody. It's a case-by-case basis. But in some cases, people who have just received the vaccine and are starting to have side effects, this is great, because I would probably not give ivermectin or Fluvox to the folks with side effects from the shot, but definitely this, maybe L-carnitine, maybe a couple other things would be great. If you do have COVID or COVID-like symptoms, or you're taking long to resolve all your symptoms, if you're not getting where you're supposed to get to and you've had monoclonal antibodies and you're doing everything but you're still sick, come see me. I'll put the link down below for my COVID clinic. It's all internet-based, so it is safe. And I will throw everything at this in a personalized approach to get you to feel better faster. My last study, this was brought up just as an old drug, a repurposed drug. And that's what this is. It's an old drug, but it went over the counter, so it's not really a drug. It's not a prescription. You can get this anywhere. There was one point in time about 9 months ago when NAC could not be found. The government wanted to hold off and not put it on the shelves anymore, but they couldn't. It's a supplement. You can't do that. It has been repurposed for several different things, mostly because the science is very strong. And especially with COVID, different countries have invested in figuring out why is this helpful for COVID. In the same stride, there was a study that I think it's in this paper where they studied the effects on H1N1, and it was positive. It was a helpful use of this supplement in addition to other things that they were using for the infection. So here's some of the diseases that they studied in this paper. So let's see, hopefully you can see. This is Jerry's summary of several different diseases, but just to call out a few: polycystic ovarian syndrome, male infertility, sleep apnea, influenza, Parkinson's disease, multiple sclerosis, peripheral neuropathy, diabetic neuropathy, stroke, Crohn's disease, ulcerative colitis, schizophrenia, bipolar disease, obsessive compulsive disorder, trichotillomania. And so it doesn't only help in the physiologic improvement of lung disease, it also helps in neurological disease. It also helps in mood disorder, OCD. This has been great. If you check out, you can do it yourself. You can go to PubMed or NIH, do it in a Google search, NIH, and then space NAC, and then space OCD, and see what you come up with. Now, it'll give you these big studies, but if you don't have to, if you don't know how to read these studies, you have to take it with a grain of salt until you know how to read the reliability of the study. But if you're just trying to search and get an idea, I think you can read the beginning of the abstract, the conclusion, and or the discussion, and you can get a good idea about how these things work and is it worthy of trying. Now, I just have to tell you, this is not meant to be medical advice. So take the information from this, if you took any notes, and bring it to your doctor and ask him, is this fair? If you're on a blood thinner, you definitely have to ask your doctor, because the data hasn't shown what you do if you use this and a blood thinner. So I would be very cautious if the lady that I met at Fruitful Yield was still on Eliquis and we were going to give her this, or if Rich is going to take this and the doc decided in the hospital to give him warfarin. It could be a problem. I did not come across any studies that used this and blood thinners together, but you have to be careful. So bottom line is that this can serve as an antioxidant. This can serve as a clot buster. This can serve as a mucolytic. This can also serve as an improvement to mood disorders and neurological deficits and neuropathy. So all around, there's many different biomechanical and pathophysiology steps of how this works, and you can probably look it up on your own and maybe I can do a deeper dive in a video, but not now. I think that it's just to bring up to your just to bring it up as an idea that you can take to your doctor and see if it pertains to you. But I think that's what we need now, is because especially with COVID, if you get COVID, you're kind of on your own, except for monoclonal antibodies, which a couple of my patients have gotten at some ERs, but really the effects were, it was one time and I was not impressed. It theoretically can help, but I'm just not impressed. I'm more impressed with the way my patients get their sleep, the way my patients take their vitamins, the way that my patients continue eating properly. There has to be a way when you have COVID or when you have a disease process like the ones I mentioned over here, on personalizing the approach back into health. Because a lot of these disease processes usually come about as you get older. And that's the whole aging process. And that's why I wanted to do this, because if you read the data, it says great antioxidant. It's a great antioxidant, but what does that mean? Does that mean that all of us as we get older oxidize? In a way, yes. There's oxidation reduction formula, but I'll save that for another day because that's going to be a whole speech in itself. Bottom line is that with all the data nowadays that I just showed you, the scientists and these institutions are breaking it down into the biochemical pathways and showing you using step by step how things like this work, and which is really awesome. And sometimes it's getting really down deep into minutia. But if you like that kind of stuff like I do, great. If you don't like that kind of stuff, you just want to take it, then fine. 1,200 milligrams a day. You do it for about 12 weeks and you see. That's because they're supplements. They don't work overnight, so you have to be patient. And if you decide to take this and you're impatient, and in a week you do something else and you do something else in another week and you keep on adding and stacking, and then you wait for an effect, you're not going to know which thing. So you have to be really patient with this stuff and observe and then reflect. So that's the way I would do it. Hopefully this gives you a couple of good ideas about NAC. Again, you always have to bring this to your doc and make sure it's okay with your medicines. Be smart about how you're taking your supplements. Thanks for watching up to this point. If you have any questions, put them in the comments down below. Otherwise, I'll see you at the next video.